Healthcare Reform Affordable Care Act, PPACA, Obamacare. Well, so many names with a book of thousands of pages. Wouldn't it be great if things can get simplified? So our objective of this presentation is to have a simplified version and summary of healthcare reforms, aka Obamacare. Before jumping into its details, let's understand the problems, history and objective of this reform. Grading reforms is not new for governments. Medicare and Medicaid were the outcome of healthcare reforms in 1965. Similarly, EMTALA, which lays foundation for ER service delivery, was established as a part of COBRA in 1985. But these are the loopholes of the previous reforms which became some of the drivers of the next healthcare reforms. Let us look at some of the drivers of ACA 2010. With $2.5 trillion of healthcare spending, USA ranked first in the whole world as far as healthcare spending is concerned. Yet, on the other side, with ranks of 20th and 27th in life expectancy and infant mortality, it paints a different picture altogether. USA has more than 46 million of uninsured population and 80% of which is coming from the working families. This data shows that the healthcare spending is not used efficiently. Not only that, increased readmissions, prolonged hospitalization, poor clinical outcomes, and exceptionally high ER admission also raise question upon effectiveness of the whole system. It is also apparent to understand US healthcare reform history before taking a plunge. The objectives of ACA are very clear: availability, affordability and quality of care. Now friends, let's get the lay of the land as to how healthcare reform will be meeting these objectives. With an intent of staying healthy as a right of every taxpayer, the new healthcare reform have abolished policies like pay visiting condition and caps on procedure and services. It also created bundle of some essential health services for which member will not be paying co-pays anymore. For example, preventive services, rehab and maternity services. With initiating concepts like accountable care organizations, government have provided more weightage to the outcome and overall health of the patient rather than procedure and services performed. New healthcare reform sets certain standard for insurance companies by setting up medical loss ratio or MLR. MLR governs insurance companies' internal expenditures like CEO salaries and administrative costs. On the other hand, it created provisions for youngsters who can now stay on the parents' policies up to the age of 25 years. Well, don't you think till now we have discussed all the points which are taxing to insurance companies for sure? Definitely insurance companies need relatively more funds to incorporate all of these changes. Now we'll be taking the switch of hats by discussing one of the most important mandate and revenue raiser for insurance companies, namely individual mandate. This particular clause has faced many criticisms, but this clause is typically governed by basic fundamental of insurance. Health insurance is basically financial participation of all members, whether sick or well, to tackle future unforeseen circumstances. Individual mandate also seeks participation of that part of US population which currently is uninsured due to a variety of reasons. By 2014, almost everyone has to either obtain health coverage or face penalties of not doing so. This is called individual mandate. There is a lot of confusion about this mandate. We'll try to simplify it. Friends, as per Obamacare, the crux of this mandate is if small employers' employee don't have health insurance and they are getting it subsidized from government, then employers are gonna pay taxes or penalties for the subsidies that their employees avail from government. So better provide coverage to your employees. Obamacare is encouraging innovation and cost-sharing measures to limit cost of Medicare. It is strictly reducing healthcare fraud, waste, and abuse, and performing only what is medically necessary to optimize the cost of care. Apart from this, there are certain new benefits like filling up the donut holes, meaning elimination of Part D coverage gap, and no out-of-pocket cost for certain services and procedures like preventive services. Tax credits and subsidies are given to eligible individuals in order to assist them with the premiums that they have to pay for health insurance coverage. It is basically casting the net wide. Obamacare expands Medicaid coverage to 133% of the poverty line to have more people eligible for Medicaid. Not only that, Fed is also subsidizing the cost by giving aids to states for funding the program. Last but not the least, health insurance exchanges. In order to create a competitive marketplace to buy health insurance, the concept of health insurance exchanges have emerged, where buyers can compare, choose and buy health insurance policies. Exchanges will be primarily created and operated by states, and creation of portals will be done for members' benefit.